Hi everyone, welcome to our channel Radiology Adda. I am Dr. Anil, consultant diagnostic and intervention radiologist. Today's topic is polycystic ovarian disease. PCOD or PCOS is a common hormonal disorder among women in a reproductive age group. PCOD, it has become a new gynecological epidemic all over the world, and roughly 10% of the women of reproductive age group are suffering from PCOD. PCOD is basically an enlarged ovary and increased number of follicles. There are a lot of confusions between PCOD and PCOS. PCOD is disease limited to ovaries and PCOS is disease involving other parts of the body. Maybe it has developed complications like hypertension, obesity, or hirsutism. Let's explore what are the signs and symptoms of PCOD. The first and main thing is periods. Their periods might be irregular or delayed, might be scanty, might be getting early, or the periods might be prolonged. Weight gain. They start putting on weight at the wrong places. Male pattern hormonal changes. Maybe they start developing facial hair, loss of scalp hair, change in voice. Next is infertility and acne and other skin related diseases. These patients are more prone for UTI and genital infections. Psychological disorders. They might be suffering from mood swings, anxiety, and depression. Let's see what causes PCOD and what are the risk factors. First one is genetic. Few studies have shown certain set of genes were not expressed before and they are started getting expressed now. Horrible pathetic lifestyle. That includes sedentary life, lack of sleep, increased stress, and unhealthy food habits. The third one is insulin resistance due to various reasons. So once the insulin shoots up, this will give a wrong signal to the ovaries, and these ovaries will start forming male related hormones. There are few other risk factors, maybe chronic low grade infection in the body and due to environmental or a pollution related. Then why do we need to worry about PCOD? See, if you ask your mom or a grandma regarding PCOD, they were never heard of PCOD. But the same question, if you ask your friends or colleagues or your sisters, cousin sisters, at least 1 in 10% of the women are suffering from PCOD. At my work, at least I see 10% of the women coming with PCOD. The main issue with PCOD is approx 50% of the patients they go undiagnosed, or by the time we diagnose PCOD they might have developed complications, and some percentage of the people with PCOD has a risk factor for carcinoma endometrium. Then how are we going to diagnose PCOD? Clinically we use Rotterdam criteria. That includes irregular periods, male hormone excess related to clinical features or some biochemical lab tests, and third one is polycystic ovarian morphology on ultrasound. Out of these three, at least two should be there to diagnose PCOD. Let's see how radiology helps in diagnosing PCOD. Ultrasound is the modality of choice and TVS, transvaginal ultrasound, is the preferred technique. According to 2018 international consensus, there are two main criteria to select patient for ultrasound. The first one is patient should have attained more than 8 years after menarche, and the second one is patient should be more than 20 years of age. On high resolution transvaginal ultrasound scan, each ovary should measure more than 10 cc, or each ovary show more than 20 number of follicles. Other associated features also seen in PCOD are increased stromal echogenicity, string of pearl sign, and follicle size should be around 2 to 8 mm. But if a postmenopausal woman shows lab features of increased androgen hormones, always think of ovarian tumors. Other differential diagnosis includes congenital adrenal hyperplasia, Cushing syndrome, and hyperprolactinemia. Then, what are the lab tests patients should do? Is there any role for MRI to diagnose PCOD? Yes, why not? We use MRI to diagnose PCOD in few conditions, like patient is quite obese and it's very hard to see the ovaries transabdominally, or someone who is not permitting to do transvaginal scan, or when the both ovaries are quite highly placed. As you can clearly see in this picture how the normal ovary looks and how the PCOD ovary looks on MRI. Let's move on to management of PCOD. In our experience, we have seen less incidence of PCOD in women coming from a low socioeconomic status. So just follow their lifestyle, your PCOD will definitely be controlled. First one is diet. Don't overfeed yourself and keep a track on your calorie intake. Low carbohydrate, high fiber, high protein diet should be followed. Eat as much as fruits, vegetables. Next is workout. At least 30 to 40 minutes in a day, minimum 4 to 5 days in a week. Each one should work out. See, workout will increase your bone strength, it will increase your muscle strength, and it will definitely reduce your insulin resistance. You can try some various yoga and meditations. Next is sleep. Minimum 6 to 8 hours in a day you should sleep. Medical management. These include OCPs and some hormone replacement therapies, and these medical managements are very much handled by gynecologists. If you have any questions related to this topic, feel free to ask questions in the comment box. If you like my content, please like, share and subscribe to this channel. Thank you once again. Have a good day.